3, 4, 5, 6. Actually, we have a quorum. If Margulis can count. All right, here we go. Let me
You are
see.
live, Heidi.
Thank you. It is with best wishes for a celebratory Derby Week that the chair calls the May 3rd, 2023 monthly Board of Health meeting to order with a pledge to expedite our business within the hour. This meeting is being streamed live on Facebook. The board welcomes Dr. Christina Bryant, who joined the department's leadership team as Associate Medical Director. Dr. Bryant is Professor of Pediatrics in the Division of Pediatric Infectious Diseases at U of L School of Medicine. She's currently the president-elect of the Pediatric Infectious Diseases Society, the world's largest organization of professionals dedicated to the treatment, control, and eradication of infectious diseases among children, and had many federal and state appointments. She is Norton Children's Hospital's epidemiologist. First, the minutes of the April board meeting have been distributed. We do have a quorum, so following any discussion, the chair will entertain a motion to approve those minutes.
So moved.
Second?
Second.
Thank you. Any opposition? Any abstentions? The meeting minutes are therefore approved. Today, our perspective session focuses on one of the most challenging but perhaps collaboratively solvable public health issues facing our community today, stemming the rise in gun violence. This discussion will reflect initiatives in other geographies to address similar situations. Your pre-reading materials included a policy paper and policy recommendations on community safety from the Big Cities Health Coalition. As you know, Louisville is a member of this coalition. In post-meeting follow-up, I'll include some related data from the Greater Louisville Project on the subject entitled Safer by Design 2023 report written by Lopa Maratra, its director. Joining us today for our perspective session is Paul Callanan, Director of the Office of Safe and Healthy Neighborhoods, OSHN, whose previous experience in similarly situated cities is a tremendous asset to our city's ability to overcome this dangerous and troubling trend. Joining him will be Pastor Nathan Horton, pastor of the Father, Word, and Holy Ghost Church of God in Christ. Pastor Horton is one of the several faith-based liaisons working with OSHN on the Community Sanctuary Project, providing trauma assistance to those impacted by gun violence. As well, Paul Kern, the Health Department's highly experienced emergency and community preparedness administrator, and as I like to think of him, Paul of all trades, to the department, will be available during the Q&A session. Paul Callanan is the director of the Office of Safe and Healthy Neighborhoods. His professional background and experience in developing comprehensive solutions related to complex community violence issues make him the most appropriate collaborative leader for developing community-based training partnerships and solutions. He's worked for several years in partnership with the U.S. Department of Justice, providing technical assistance and critical training to national, state, and local government leaders on topics related to public health and criminal justice while reducing gun and gang violence in schools, especially in underserved areas. Among other roles, he was director of the gang violence reduction effort in Denver's Department of Public Safety. Paul holds a degree in social science from California State University. He's committed to emphasize gun violence solutions through community partnerships, mobilization, juvenile justice, and evidence-based solutions. He will share some of his initiatives and perspective this morning. Paul, as I mentioned, we are extremely honored to have you join us this morning. The floor is yours.
Well, good morning, everybody. Thank you for having me. I'm always interested in talking about this topic of gun violence reduction. It impacts all of us here in Louisville, not just nationally, but here in our own city and across our city. And basically everybody's affected by violence, gun violence in our city right now. What I want to talk about this morning, while I have you here, is really a couple of things. I want to focus on what OSHN's doing right now as an organization. What are the services and programs that we're currently providing? What are we doing as sort of the backbone agency for the city itself as reducing gun violence? And then talk a little bit about my reflections on sort of what works, what doesn't when it comes to gun violence, and where does Louisville sort of sit within that realm of effectiveness. So OSHN is an agency, obviously, within the city. Our mission is through partnerships and collaborations. We intervene with those involved or impacted by gun violence and promote community and youth-led solutions to foster safer neighborhoods. When OSHN was originally designed years ago, it had a much wider focus on violence in itself, and that included suicide, domestic violence, teen violence. And unfortunately, what happened, it kind of pulled the agency in a lot of different directions, and the agency itself never really was able to come to a full focus on what needed to be done. So in the short term right now, what OSHN is primarily focused on is reducing gun violence in our city, with an emphasis on reducing gun violence related to group and gang violence. It is our hope that we will eventually get back to looking at suicide in a larger perspective. But right now, we're focusing a lot of our energy on gang and group violence, which is a large contributor to the gun violence that we're seeing in the city. And as I said, we look at gun violence from different angles, and we fund a lot of different programs. We are primarily funded through three sources right now. We have general funds through the city. We have ARP funds. So one commitment that the city did make to reducing violence is they awarded OSHN $23 million in federal ARP dollars over the next couple of years. So from OSHN's perspective, we're very well funded right now through the city to address violence as an agency. And we were also bringing in federal grant funds. So just last week, we found out we were awarded $4 million from SAMHSA for the trauma resilient communities to continue. We had a 4-year project, a 5-year project that just ends this year, and we received the renewal for another 4 years at $4 million. So we kind of combined our funds on that. So I think we're adequately funding as an organization. We address gun violence in 4 areas that we're focused on right now in our city. And we break those up into 4 divisions in our organization. The first is our pivot to peace. And that's really our outreach approach. This is our approach of how are we engaging those individuals and families that are actively involved in gun violence right now. The people that are in the conflicts, that are pulling the trigger, that are direct victims of violence. How do we get in there and mitigate that? And our Pivot to Peace program really focuses on the concept of community violence intervention. And that is really using outreach workers, people that are credible messengers, people that have connections to these groups in the community to really reach out, engage, provide services, and really try to promote desistance and disengagement. So desistance from crime and disengagement from those groups or organizations that are leading them to be involved in gun violence. What Pivot to Peace entails is a partnership between multiple agencies within the community. We have a partnership with the University Hospital, where we have a program there where we fund positions at the hospital where individuals that present at the University Hospital with gunshot wounds immediately are provided direct intervention services through trained staff at the hospital. We have 6 organizations, 6 sites around the city that we're funding right now that do direct violence interruption, which means they're out in the streets every day looking at those groups and individuals that are in conflict and trying to mitigate those conflicts. That is a new program. We just got that up and running. It will take a little bit for the capacity building of their part to get to a level where we're going to start seeing some results. But all those programs are fully functional right now. We have a 12-person team inside OSHN. This is the only direct services that OSHN provides. Primarily, most of our funds that come to us, we contract out through the community. With the exception, this is one unit. We have 12 outreach workers that work in-house that provide long-term case management services to some of our highest risk youth and young adults in the city that are involved in gun violence. This is based on a model that's been proven effective in other cities. We recently took part of a study, 3-year study in Denver, where we did a randomized control trial of the similar model of can outreach workers actually be effective as a catalyst of change. And what we found recently with those results that were just released was that those individuals that work and build a relationship with outreach workers, 70% less likely to be involved in violence, gun violence. So we do know that the use of outreach workers are very effective in helping individuals adjust their behavior. Now, here's the interesting thing. It's not as effective at pulling people out of gangs. It's very effective at helping them navigate through the violence. And at the end of the day, if we're looking at reducing violence, that's what we're looking for, changing behaviors of individuals. And that was based on one of the first randomized control trials in the country related to the use of outreach workers. And we've adopted that model here in our city as well, too. So under our pivot to peace with the different components, what we also do is we do coordinated case management, which means we have an multidisciplinary intervention team, because most of these individuals that are involved in gun violence and we're working with them, they're also involved in multiple systems, whether it's social services, whether it's juvenile or criminal justice system, and they have multiple case plans, which causes a lot of confusion. So what we're doing is developing a process where collectively we're bringing all.
Oops, we've lost you went on mute.
Sorry about that. So we looked at how we bring all agencies together and work together on coordinated case management. So agencies aren't pulling individuals in different directions on that. So our Pivot to Peace initiative, as I said, is really the coordination and collaboration of multiple agencies focused on those individuals driving the violence. Our second division is our trauma resilient communities. And that's really how do we look at providing quality services to direct victims of gun violence and indirect victims of gun violence. So the secondary exposure to gun violence in the community. So we fund a large number of counseling programs, trauma-based counseling programs. We provide funding for a lot of training of counselors across the city related to effective trauma counseling, racial therapy type services. We have 2 programs that we're funding under ARP right now, which is one is focused on, again, a collaborative victim-centered multidisciplinary approach of how do we work with victims of gun violence collectively across disciplinaries through a team-based approach in the short term and the long term. So we ensure that both short-term and long-term needs are met. And then we're also working with our community sanctuary project, which is a partnership between our faith-based in Louisville, our mental health partners, where we're responding directly to communities that are impacted by gun violence and providing opportunities for spiritual, emotional assistance within 72 hours of a shooting within a community to really sort of like a triage. It's not direct service, it's more of a triage for people who just feel like they need to speak to somebody. Our third division is our Reimagine and Network, which is really looking at giving the community voice and ownership over gun violence solutions. So we do that in 3 areas. One, at the individual level, our Ambassador Institute, which is probably best known for OSHN. What we're best known for is we provide direct training to individuals through our institute on how they can be involved in violence reduction efforts across the city. And we can help connect them to organizations where they can volunteer their time in doing that. Our second level is capacity building. So each year we work with like 10 to 12 different organizations that are very grassroots, and we help build their capacity and for sustainability to do gang violence or gun violence type work across the city, which means we look at where they're at, where they need to be. We help them develop a plan of sustainability, whether it's becoming a nonprofit. So basically, how do I take my idea and turn it into, an actual program, a fundable program? We're working on that. And then finally, in that area, we work with 6 sites in the community right now, 6 neighborhoods where we have community teams, violence prevention teams, which consists of residents, businesses, nonprofits in that area that come together in that neighborhood and focus primarily on that neighborhood of what they can do to reduce violence in that area. And we fund those ideas. So they come up with a plan, a short-term and a long-term plan, and we're funding their ideas in their community. It gives ownership to them to determine what's best in their neighborhood at a smaller scale. And then our fourth division that we focus on is what we inherited from RCS, which is our youth engagement services. And this is the old Office for Youth Development. And it's really the prevention aspect of looking at youth across the city and how do we fund effective programs to ensure successful development of our youth. So those are the primary four areas that we're focused on right now. But serving as the backbone agency to the city's collective efforts to reduce violence is something that we've really been looking at stronger over the past year. We want to better understand how we can play that role. So over the last couple of months, we brought together through different forums, people from across the community, organizations from across the community. We hosted a town hall summit where we brought about 100 folks together, and we looked at what are the challenges of the community working with the government on, violence solutions? What are some of the barriers that are presented? And we followed that up with a 2-day summit where we had about 250 individuals over the course of 2 days come together and really talk about how well we're working together, and then what are some of the solutions that we should be looking at, and what are some of the gaps in services. And I was going to give you some of the results that came out of that. There's a larger report that's coming out on that. And part of that analysis, what we were doing under that 2-day summit is we surveyed about 300 organizations across the city. And some areas that we looked at beyond what do you do is who do you work with and how well do you trust other organizations? And basically, here are probably the top 4 things that we found from all those efforts that we're going to be looking at. One is it's unanimous amongst everybody that there needs to be a process for collective accountability. That is, not only how do we hold the government systems accountable for reducing violence, but the community as well too. So organizations that are getting funding in the community, how is that accountability being managed and put in place? So there's a collective accountability where it's not just the government's responsibility, but everybody's responsibility. But how do we ensure that people who are being asked or tasked to do something are doing it, and we're holding them accountable to that? The second was the level of collaboration. So when we interviewed everybody, less than 2% of our organizations, everybody knows each other, but less than 2% of our organizations in our city indicated they actively work together to reduce violence, which means their program is working with other programs. In a city the size of Louisville, we would have expected those results to be around 20%. We're at 2%. So in our city, although everybody's doing a lot of work right now, we're very siloed. And part of that is we need to build that process of building relationships between organizations and between people, so we're working together better. Equitable funding, and that wasn't just, hey, West End versus East End funding. There's also a request for sort of tiered funding. That is, there is a level of frustration that the larger organizations continuously get dollars because of their structures, because of their abilities, but grassroots kind of feel like they get smothered out, that they're not getting that opportunity to get funding. So it's not just funding versus, locations or organizations, but really do grassroots organizations, are they being focused on for funding as well too, as long as the larger organizations. And then the last thing that was collectively agreed upon that came out of that is there is this need for leadership. And that doesn't mean, the mayor's office or anything else. Is what people understand, that things need to be done to change. And what they're expecting is that collectively we come together and put a process that's providing leadership for that change. So that would maybe look like something like an oversight board within the community and within the community of Louisville. Could just be, an existing board or existing committee or something, but someone that is sort of leading the effort of moving our efforts forward and ensuring that people are working together. So with that, I come back to one of the questions that was asked of me to come on here was sort of look at my experience and say, what would I recommend for Louisville? How is Louisville doing? So when we look in general about when we're typically work with cities around the country of who's most successful in driving on reducing gun violence, there are certain things that come up and play. And really, it revolves around sites that set up processes for accountability, transparency, and sustainability. Because at the end of the day, our return on investment, anything that we do is the public's trust in that we're doing the right thing, right? That we're making a difference. So when we talk about accountability, as I said earlier, how are we holding everybody accountable within our systems that we're doing the right thing? If we're spending $23 million on violence prevention, how are we ensuring that those organizations are doing the work? How are we ensuring that organizations are working together? And I'll give you this example. You know, how often look at the three agencies within the city itself: public health, OSHN, police department. We all play a very large role in the area of violence reduction. How often do those agencies meet to discuss violence, the gun violence in our community? And the reality is probably not that often, not as much as we should be, right? So we need some sort of a neutral oversight process, again, that's looking at that, that's making sure that we're holding ourselves accountable collectively in achieving the most effective and efficient way to reduce violence. The second is transparency. And I think this is most important because this gets lost a little bit in Louisville right now of how we're doing things here. Transparency kind of involves different things. Do we have a clearly defined idea of what the problem is in Louisville? We all know it's gun violence, right? But have we done the thorough assessments of really where's the reports that show gun violence throughout the city, gang violence, group violence, domestic violence? Where is that? Have we looked at the populations and stuff? Typically, you want to do a real thorough analysis before you start allocating resources to problems, right? So, but we're missing sort of that study or that analysis, and it needs to be ongoing and updated real-time data. One of the things that when you're doing a gun violence reduction plan, because it's very comprehensive, there needs to be a written master strategic plan, a comprehensive plan across the city, a plan that everybody can look at. If I'm somebody in the community and I want to get involved in gun violence reduction, that I can go to a site where there's the city's plan that allows me to look at and say, this is where I fit into that plan. I could do this work. I can do this work. Right now, there's not a coordinated effort where there is a master plan. The best we come to is we put pillars up. We may say, hey, we're going to do something in this area, but a plan is really specific as to what is that collective agreed upon strategies under multiple areas that we're looking at violence. It also allows us to ensure that we're looking at everything holistically, not just in silos. So we do need a written plan in the city. And within that plan, there needs to be common language. We need to be speaking the same language. And here's the biggest danger that's facing cities across the country right now. There's a huge influx of funding has been coming out under the new administration for gun violence, especially under community violence intervention. But that's very poorly defined and loosely defined. And what happens with that is we have multiple models around the country that deal with gun violence. We hear about the public health model, the group violence intervention model, the community violence intervention model. There's all these different models that cities are picking to utilize right now to address violence, but they're so poorly defined right now that it's convoluted in a way where we're sort of diluting the effectiveness of programs. So let's give you an example. Group violence intervention, is proven to be an effective program to reduce gun violence if implemented to fidelity. There was a specific model. It was designed in a way, studied in a way. Violence interruption programs, Cure Violence, which we're doing here in Louisville, designed in a specific way to produce results, which did produce results. What's happening around the country right now is people are taking these projects and they're putting their own twist to them. And the fear of that is if you're not holding to the fidelity of those models, you're not going to get achieve those success rates that those other cities did. And that's the biggest problem we're having right now. So in Louisville, we have multiple models going on simultaneously. We have GBI, we have CBI. We do preach the public health model. We need to clearly understand and articulate amongst ourselves, as a community, define what those mean and really define how those projects work and how those projects work together to complement one another. So all that needs to sort of be in our transparency, as well as, evaluations of programs. Sustainability is critical right now for public trust. And that is, we hear this consistently. Why should I work on this project? You guys are funding us. In a year, it's going to go away. been around 20, 30 years. This happens all the time. You know, we're just going to do our own thing. So collectively as a city, we have to ensure the sustainability. I think that is a strength in Louisville right now. A lot of cities our size did not commit the amount of funding that Louisville committed to for ARP funding to violence prevention and reduction. So I think that's a huge strength right now in Louisville. But how do we ensure sustainability moving on beyond just, hey, we have funding right now and it's set to expire in 2 years. So how do we do that? And that's just not about putting money to the problem. It's about understanding what works and building partnerships. Very often when we look at new ideas, we move to, hey, we need funding for this new idea. When the reality is we may be able to implement a lot of new programs just based on having different organizations come together under existing resources and work together. So the idea is less about let's push in funding all the time, but better understanding what works and then how collectively, if we're just working together better, we can achieve our goals. So I think if you're looking at that with Louisville, you know, accountability, sustainability, transparency, a lot of that will come out of a strategic plan that OSHN is working with a lot of our organizations right now. We're currently mapping out the ecosystem, which is critical to understand. When we typically talk about gun violence, it's the same 4 or 5 organizations that are brought up in every conversation, when in reality, there's hundreds of organizations and individuals across the city every day that are working on gun violence. So we've the last 2 months, we've been mapping out this ecosystem of really determining where people are working within that ecosystem and how well they're working in that ecosystem and where are those gaps. So for example, 2 large gaps that we've seen right now in our gun violence reduction efforts are there's very little gender specific programs for girls that are probably ages 14 to 24 that are involved in gun violence. And we know that you can't put females in the same type of gun violence reduction or gang violence reduction programs that you put boys. They're completely different approaches. So a gap in our services is treating younger girls or addressing younger girls. And then the second need now is a growing population in our city, which is our refugee communities and our Spanish-speaking communities right now. We're seeing an increase of violence, group violence within those communities as well too. So we'll be focusing our efforts in that area. So looking at Louisville, our strengths are we recognize we have a gun problem, which is a big step. A lot of cities try to downplay it. We recognize we have a gun problem, and we have a lot of people that want to do something about it. Assets is not a problem for Louisville right now. We have a lot of people that want to be part of the solution to gun violence. The weakness we have right now, though, is we're working in silos, and we need to figure out a better way of how we're all working together. And really sort of this lack right now of coordinated effort across the city, multidisciplinary effort that ensures, again, that accountability, sustainability, and transparency. So hopefully I kind of give you an overview. I know it's kind of long of everything that's going on with the city. I believe Nathan Horton is on the phone, on the call, on the phone. I'd like to give him an opportunity to give his perspective from the community side. Nathan, are you on the phone? Are you on this call?
I don't see him on the chart, but that doesn't mean he's not on.
I believe he was calling in, but we probably missed him. But I know there was a desire to get sort of a community view as well from
Right.
systems.
We're just glad you've got someone, and from what you wrote and I shared with our team, the good work that he is doing, especially in affecting those during times of trauma and that kind of case management. So I'm going to open the floor to questions, but I want to, before that, I just want to overemphasize something that you said, because it's a problem that permeates not only public health in the metro area, but it really affects all aspects of the community in both the private, not in both, but in the private, public sector, academia, faith-based, et cetera. And actually faith-based does a better job of this than the other sectors. And that is that this is a community that operates in silos, and bringing everyone together is critical to moving this community forward. And I say that as a native Louisvillian. And it's been one of the hardest tasks that a number of people have been working on. I'm embarrassed, and I think Deputy Mayor Nicole George understands this. But the fact that people in the East End don't know people in the South End is, and the inequitable allocation of resources in the community, be they financial, human, whatever, is something to work on. So thank you for making that point. And the more that all of us on here through our networks can connect, it's fairly critical. So I open the floor to questions for Paul. And as I said, his experience in major cities involved in similarly situated circumstances makes him a real asset to the city. Colleagues, floor is yours.
I want to say on the front end of this conversation that just how fortunate we are in Metro to have Paul's leadership in OSHN. And I was reminded of that last week when Deputy Mayor James and I took a tour of U of L Hospital. And we really heard from frontline service providers on the value of pivot to peace and exactly what value it brings to the community. And I think that is often less understood. You know, I appreciate very much Paul's recognition of transparency and accountability and dilution and the need to hold to fidelity and all of the challenges that I think have plagued our community's understanding and appreciation for OSHN. And so, Paul, I just want to say you're very much appreciated from the mayor's office, and know that it makes us really proud when we go out into the community like at U of L and hear those providers say, pivot to peace makes a huge difference. It is impacting outcomes, and it is certainly needed in the community.
Thank you. Others on
Good
the,
morning. Excuse me. Can you hear me? This is Pastor Horton.
yes, hello and welcome.
Yes, I'm sorry. I was muted and
That's okay. It happens to all of us, Pastor. The floor is yours. We seem to have lost you. Well, we'll hold until he chimes in here. And questions from the board? I think, Dean, you had something?
Yeah,
Did you?
Paul, this is Craig Blakely from our public health school at Louisville. It was very interesting to hear you talk about implementation, dissemination, adoption kinds of issues. Actually, it's funny how research goes in cycles. There was a whole bunch of work in that area done back in the 1980s that spoke directly to the friction between adaptation and fidelity, or reinvention and fidelity, as you quote, replicate nationally disseminated programs. Did a bunch of work on that back then, and I would love to talk more about some of those kinds of questions to get a handle on, you know, what's going on here in the city and how we might be able to bounce some good ideas around. Good to hear you talk about that, though, because it's absolutely true that fidelity has to do with directly related to the ability to replicate outcomes. But on the other hand, sustainability or routinization and longevity is kind of related to the ability to own more of the pieces of things. So there's this give and take, but it's a very interesting set of issues. And I'll reach out to you and we can chat some.
all right.
Great,
Can you
thank
hear me
you.
again? Can you hear me again? This Pastor Horton.
Yes,
I'm
sir.
sorry.
Yes, Pastor, please continue.
All right. I'm sorry. Well, Mr. Paul Callahan had gave a great summary of what's taking place in Louisville and in the community and dealing with different agencies. Community Sanctuary Project, our goal is to be.
You faded out on us. Hello? Esther? Hello? Okay, well, we'll wait till he comes back. And Dr. Bautista Severa, a question?
More than a question, a comment. Thank you so much for allowing all of us to learn that there are 300 organizations already working in this, and the main trouble with this is the non-communication among the organizations working. And I love the way.
I'm sorry.
Go ahead, please.
It keeps cutting me off, and so I'm very sorry. So let me be very quick because I don't know why it keeps cutting me off the phone. But our position is to do what we can when a gunshot wound victim takes place or homicide takes place in the community. And Community Sanctuary Project is for us to try to do all we can to sustain or try to deal with gun violence in the Louisville community as we partner with OSHN. Community Sanctuary Project is it's a faith base, and there's a few of us that are on the faith base. So our position is if we realized that we couldn't respond to every homicide in Louisville. So we adopted two communities, Russell and Newburgh. We've already had an engagement to present ourselves in Newburgh. And so the first one we did, if y'all remember, the young man got killed at the bus stop. And so we got together at Moore Temple. We found the church at Moore Temple. We got together at Moore Temple. We put together where we were able to bring different agencies in, counseling in. We did it for that one day. We had 24 hours to get it done. And so we were able to get it done, and it turned out to be a great success. And what I mean by that now is the people came out. We were able to feed people. People came out for counseling. People came out for healing. The community rallied and came together under that incident. Excuse me. And then the next one that we did is that we did one when the Chickasaw Park took place, and we went there at Chickasaw Park. We had the barbecue grill where we brought the community back to the park. The community was afraid to go back to the park, and we were able to bring the community back to the park. And then from that, we were able to get 17 churches visual in less than 24 hours. I don't even think it was that long, that much time, to get 17 churches to participate, to allow us to use their facility, to be able to have counseling and have people to come together for a one-night visual for not only for the mass shooting that took place at the bank downtown, but also what it took place in Chickasaw Park, and also that it took place down at the school, because there was a shooting the same day that took place. So Community Sanctuary Project, we're trying to do all we can to have an impact in the community and to rally to bring the community together. So if a homicide takes place, and we're recruiting churches all over the city to participate, to be a part of this, so that, because we understand that not only we need these agencies to come in to help as we're dealing with gun violence, but we also understand that the church plays an important role, an important part in that community. So we need to get the churches together so when these incidents happens, that we can rally the church to come together to where it can have an effect to bring the community together as well. And we can use that church. We voted on the board that, we want to use the church. We want to leave the church a stipend. So as I get ready to go, I hope what I'm saying, it makes sense what I'm saying. Can you all hear me?
Yes, sir. And let me just say that faith-based institutions have tremendous impact that can't be replicated by other entities. And what you are doing is really blessed. And it's one institution that a lot of people have not lost trust in. And
Yes,
so
ma'am.
you hold something very important. And I want to thank you and all the people in your group for
Yes,
what you are doing. And this board pledges to you our cooperation. And
Yes, ma'am.
if you will share with Paul and he'll share with Deputy Mayor and all of us, if there are policy issues that public health issues or barriers or anything like that, you let those people know and we'll bring it back before this board. But thank you, thank you, thank you.
Thank you. Yes, ma'am.
Okay, there were some hands up. Dr. Bautista Cervera, please continue.
Yes, thank you. Well, you know, the pastor just gave us a really great example of what is needed within our city, and it's communication and partnership and working together. And Mr. Callanan just mentioned that now, you know, refugees and migrant communities are starting to witness and to have the troubles with gun violence that were not, you know, for some of these communities are new. For some of these communities that come from war zones, it's not new, but it's different. So I would appreciate to add on and to keep in mind all these communities and bring them to the table, you know, as a stakeholders and as a member of a Spanish-speaking community, we are willing and we are able to be a bridge, you know, of communication among the ones that speak English and the ones that cannot. But there's always a member of each community willing to work and to participate. Thank you.
Paul, let me ask you this, and it's from my lack of knowledge. Dr. Bautista Cervera clearly, in part, represents La Casita. And so I would ask if both La Casita and the Kentucky Refugee Center, and I know a number of churches are working with refugees as well, including a lot in the end of town I live in. But if we'll get that coordinated, that would be great. And I would also ask the city to ensure that La Casita and those entities are on any collaborative, in all collaborative areas as they affect. And the only thing we cover is public health, but public health is all consuming. So thank you so much. And next question from board members. While I look at you, one last question, Paul, and that is, and not that I want any, or that the board is asking for them. Are there any policy areas that the board should consider as we take a look at where you talked about gaps? And don't have to necessarily give us an answer here, but if you could get those to Deputy Mayor George, and she'll get them to me or to Arlena for the board to consider, because I think that's really important, especially ideas on how we can collaborate better.
Yeah, I could get that, you know, look at things as far as policy, nothing specific, but I think there needs to be, you know, and I'm sure there is there already that commitment from public health in the sense that they are central to violence reduction. So what role will public health play in sort of leading this effort, you know, in partnership with
Well,
OSHN?
let's do this if we can. And because we have a number of people on the phone, we could generally say, but it will need your verbiage. And if the deputy mayor has anything to, or anyone on this call has something to add, just an overall sense of the Board of Health about a policy position. We have enough to vote on that. So as a person who likes measurable outcomes, that would be a starting point. So if there's something that you think we can do today, we're happy to do that.
I would say that commitment to form a partnership with the key agencies within the city right now, which would be OSHN, LMPD, to meet on a regular basis, to look at collectively how we're working as a city to address violence would be greatly appreciated and
Perfect.
needed.
Perfect. We'll turn that into a motion. And I need a board member to propose it.
I move that LMPD, OSHN, and the Board of Health meet on a regular basis to review how they work in partnership on violence reduction.
Does that do it, Paul?
Well, that works for me. Yeah.
Okay, is there a second?
Second.
Second.
Thank you. Is there discussion? Ready to vote? All in favor, aye, or raise your hands.
Aye.
Opposed? Abstentions? Motion carries. So, let's see. The best thing to do, Paul, is for you to write it out, and then we'll have Natalie Johnson, who I think's on the call somewhere, make sure that it flows in the right legal format. I operate as a lawyer unlicensed, so, but I know when I need one. Nonetheless, I think that's a step forward, and we will do whatever we can do. If there are additional materials for the board to look at, we're happy to do that. Are there any other comments from the board?
Could I ask, as Pastor Horton, could I ask if that takes place, if Paul don't mind? I don't want to be out of step because we under the umbrella of OSHN, that if they do that, could a faith-based be a part of that meeting?
Yes, sir.
Should
Keith
we?
Layer. Yes,
should-
yes,
Should
ma'am.
we add organizations that have been for years dedicated to the prevention and reduction of gun violence in our city as stakeholders participating at those meetings?
I would suggest this, if I may, allow the three agencies to come together to kind of work out within the system, the city itself, of how we're working together. With the idea that that grows to sort of larger organizations that are coming in. And I say that sometimes because sometimes city agencies have to get used to working together and have those discussions before we're bringing in community groups to work with the community. Because we have to understand how to work together better as a city agency and then bring the community. So the ultimate goal will be to create a larger inclusive. There is the Louisville Alliance for Sustainable Gun Violence right now, which is a very large alliance that's taking place right now that has a lot of community-based organizations that are involved in that could be kind of connected to this. But I think it's imperative that from a city's perspective, that these agencies kind of sit down and talk initially.
So I think that's excellent because it hits at absolute collaboration and non-duplication. And if we could get yourself and a limited number of people, 3 to 5, to ensure that we've taken a look at everything out there, and I think you probably haven't based on your comments today, and then come back to the board with an update, that would be great. But you have the sense of the board that we're moving forward with the best means for outcome measurement. In other words, that we are stemming the rise. I guess we'll call that a success at the very beginning. And does that make sense to everyone? Shaking heads.
Yes.
And Pastor Horton, you're a critical part, so your name is on the list. That's sometimes dangerous in and of itself, but thank you so much.
Thank you. And
All
thank
right,
Paul.
group. Anything else?
Madam Chair,
Yeah.
quick, go ahead, Paul.
Yes?
If I can add one more thing that this
Yes,
group I
sir.
think could help with is there's a lot of questions going on right now. It's budget season, so there's a lot of questions about funding for violence prevention. And I know Deputy Mayor George is on the call, and the mayor just released his budget right now. What I have to say is that I think it's a great budget. And one of the things we talk about transparency, there's a lot of when we're looking at gun violence, we're looking at two different approaches, right? Simultaneously. How do we stop the bleed right now? And that is really what OSHN is leading. All of our programs. How are we dealing with violence right now? And with the influx of funds that came in from ARP, we have a fair amount of dollars to do that effectively right now. In addition to that, it's the systemic change, right? We hear that a lot. How do we deal with the root causes of violence? And what people are going to see in this budget, and which is often overlooked, is the amount of money that goes from the city to those elements of root causes of violence. In our budget, you're going to see, increased access to educational opportunities, increased access to employment, economic opportunities, increased access to healthcare, increased access to food banks, and more food stuff. So there's a list that goes through in there. So often what happens a lot is people say like, hey, we're not dealing with the systemic, reasons of violence or the causes of violence, when in reality, collectively we are. Because when we look at OSHN, that's not necessarily our job to do all that. We're working on the now, right? To stop the bleed now. So if we can help spread that word to people, when people start talking about the city's budget or their dollars, there's a large amount of money in our budget right now that is dealing with the systemic causes of violence in our community right now. And that's one thing that I would applaud Louisville on and the mayor's office for, is that there is a commitment to that. We just need to be in a better position to educate people on that is included in this budget, and help people understand that is the connection, right, to the systemic violence that drives violence, overall gun violence. So there is adequate funding right now. We always want more funding, sure, but the difference comes down to this from a city versus there's what I want to fund and what I want to do versus what needs to be done. Right? Wanting to be funded means I have a great idea. I want to do a gun buyback program. It makes me feel good. There's nothing wrong with that. But is that a needed program in the community right now? Gun buyback programs really have limited, impact on gun violence, but they're good programs for the purpose of it makes people feel like they're doing something and stuff like that versus the need. And I think what our city budget focuses on is the need right now, right? Do I wish we had more money just to fund what everybody wants to do? Absolutely. But our budget in our city right now and the amount of funds that are being allocated clearly, I believe, addresses the need that's in place. And I think that's a strength for Louisville right now.
Okay. Let's see, Director Myman from Louisville Metro Emergency Services, I think is on the call, with regard to, gun violence. A few moments. We're nearing the end of our session here. So thank you for joining. Any observations or perspectives on stemming gun violence?
From our perspective, unfortunately, we're more in that response thing and the preparedness. So, we try to obviously prepare the responders for responding to situations like that, especially active shooter, the situation that we had, just under a month ago. So, there was a lot of planning and a lot of effort that went into that. And, you saw that, the response was really good, in that situation. I mean, they saved a lot of lives by doing things very, very fast. And we've done scenario after scenario, and just in my 7 years, and this goes all the way back to 2013 and 2014 when we really started to look at our response here in Jefferson County, as far as police, fire, and EMS getting together, and putting emergency medical technicians and paramedics and firefighters in actual ballistic equipment to put them in a situation like this to go in and save lives. And, we learned that from Columbine and the Virginia Tech shooting that, there was a lot of people that laid in those buildings for a long period of time and literally just bled out. So by putting people in the buildings a lot quicker, in that ballistic equipment, and, I grew up as a firefighter and spent 24 years in the fire service. And if you'd have told me as a new firefighter that we'd be wearing ballistic equipment now, I'd have told you was full of it. But that's just the day and age that we live in. But, it truly saved lives. And, that day, and I'm not going to say, everything went to script. We learned a lot. We're going to hire a private contractor to come in and do an after action on the response, so that we can learn from everything that we did. I'm not going to say mistakes, I'm not going to say mistakes were made, but you can always look at things and see if there was gaps and, see what we can do better. God forbid the next time. I mean, we hope it's a waste of time, but, I mean, it go, and there was so many, things. We had a threat assessment and an outside contractor come in several years ago and did a gap analysis for Jefferson County to see exactly what we were missing. And one of the huge things that we were missing was a family assistance and reunification plan. And, you know, I was very proud of the Red Cross and Tamika Laird and the Office of, Community Services. They had a family assistance center set up within 2 hours, which is pretty remarkable. Now we learned some things from that. If any of you all were, played a part in it, there was family members that were not leaving University of Louisville Hospital, even though they knew their family members weren't there. The doctors told them they weren't there. They were not going to leave there. So we're working with the University of Louisville to potentially, in their safety and security department, to potentially find a location closer to there, not at the hospital, because that's one thing we've learned with the shootings throughout America is that you don't want the family assistance and reunification center at the same spot. But maybe there's a location within universities, buildings down around the hospital that they could give us space that we could, at least in walking distance, send people. And, I know Deputy Mayor George, you were at the Family Assistance Center, and, that was some of the issues was, just getting family members to come there. That team has already met twice since that shooting event, just to see what went good and what went bad with that and what we can do to make that better. So I was really proud of everyone, with the response. Again, it was a lot of effort and a lot of money, and time that has been spent, with training these people and a lot of review of after actions that have happened throughout in the situations throughout America. And I think we're well into the 20s with the number of mass shootings by definition, just in this year. So, the numbers keep going up and up, and we've just got to keep planning for it because, we could have another situation just like it. We had 2 in a week. They were different circumstances, but they were still considered by definition 2 mass shootings that we had in 1 week that we had to deal with. So, that's like I said, that's our perspective. I mean, or my perspective, like I said, we're constantly looking at, how we can do things better. But I'll tell you, the response was great. I mean, the police went in there and they did what they had to do. And, EMS and the fire department and the 911 call takers and dispatchers, I can't say enough, they don't ever get credit, for anything that they do. And that day truly showed that they are true public safety officials. I mean, they really, they rocked. I mean, they fall underneath us here at Emergency Services. They're part of our agency, but I can't tell you how, like I said, proud I was of them and the composure that they kept. You all listen to those calls, you listen to, the radio traffic, and, they just, they were awesome. We've had to keep an eye on them. We've had, debriefings take place, during situations like this. Obviously you got to worry about your responders. So we've done some mental health, assistance to everyone. I know the individual agencies have done that as well. We do things like bring in therapy dogs to the 911 center but the overwhelming support, throughout America. We've received gifts from Sandy Hook and Nashville and, Texas and places that have had mass shootings before. And, so that really obviously makes our people feel good. And then, obviously the progress that the officers made, has been really good. I mean, just last night, I think they said he was, still making some progress as well. So.
That's excellent, and just tremendous gratitude and appreciation for the work that you all do. I've told colleagues around the country that we, in this incredibly devastating occurrence, we were best practice in this country. And there's been a lot of negative national publicity on Louisville. And this took an incredibly traumatic, devastating effort in terms of a 3-minute response, and then all of the services that the community pulled together to assist, and the after actions that you mentioned. And it really put a positive look, if you will, on one of the most negative experiences a community can sustain. And I just, please let your team and the collaborative partners know This board recognizes that, and in our work going forward will be an integral part. And thank you so much for joining the call today, and adding voices, and you have our hand in partnership.
Well, I appreciate it, and I'll answer any questions if anyone has any questions.
Well,
about
we're
anything.
getting on time
okay,
here, so
okay.
I'll and Deputy Mayor George, I think you had something in the chat box. Do you want to go ahead?
And Paul somewhat, and actually the board action, I think, took care of this. The question was, have we started developing that neutral oversight process? And I think you guys took action, and I've already sent an email to Paul, and he's on it.
Okay,
So
well,
we're
let
good.
me know what else is needed. That's for certain. Let me do this, and I know, Dean, you have a question, and I'm gonna hold that until I get this information out, because I know people have to leave at 9 o'clock. And we'll go back to Dean Blakely. The June meeting, guys, I just want to let everyone know will be virtual only. And the pre-read materials, you'll have names and other information, but we'll also be voting on a resolution from Connie Mendel's group related to updating certain swimming pool related regulations that now need to be changed due to state and federal regulations that changed as well to ensure compliance. Note that the July meeting marks elections for officers. And I have a gavel I'd like to turn to someone, just FYI. There will be no August board meeting. And then beginning in September, we'll meet in person. Of course, there'll be a call-in option, but I think it's time for us to at least try to meet in person, and we'll work on a location, and that'll be confirmed at a later date. Okay, now 1 minute, Dean Blakely.
I stuck my comments in a chat.
Okay, that worked. Let me continue online here. Deputy Mayor George, hat off and shout out to you and the team for the food truck clinics. What a fabulous idea. In fact, I sent it over to Humana in terms of how to address, it's not even food insecurity, but issues related to systemic change in the food system. Did you want to update on anything else, including something more about food trucks?
Well, anything that is involving food trucks would go to someone from public health and wellness, and kudos to them because they're the ones who did all the work. And I would just say, you're exactly right. It touches so many facets of our community, everything from access to food to economic development. And so, and obviously supports for all of those pieces. So, I'll be very quick because I know we don't have much time. The only thing, Paul stole some of the thunder. I was gonna reference the mayor's proposed budget, and what we saw were themes and heard were themes around safety and health within the city with an eye toward investing in the future. And, I know the mayor is hoping and the council is hoping for a lot of community engagement. Paul said it well when he said you hear and see investments in public safety that span beyond the reference to stop the bleed and really have more to do with how you prevent crime in the first place. And so that runs the gamut. I won't get into it. My bet is you guys already know some of those things, but just really want to underscore that, and certainly could you just use assistance in helping us paint that comprehensive picture to the community. The only other piece I would mention is you also saw a capital investment for the Marine Hospital. That's going to have a significant impact, we hope, on operations within Family Health Center and specifically the Portland site. So anyway, happy to take questions. Don't want to take up any more time, but definitely look forward to engagement on the budget.
Well, we deeply appreciate from both you and Paul the innovation and giant steps forward that this administration is taking, just to be lauded. And we're here to help. since we're quasi-governmental and each of us has good connections. Dr. Howard, an update, and I don't know that you were on the call. I introduced Dr. Christina Bryant, so all that's taken care of. Anything you want to add?
No, first off, thanks, Paul Callahan, for a really fantastic discussion. Nothing else really to add. I just want to say Chris Bryant's been a friend for a long time and a very welcome member of our team. And I think her expertise, although we only got a small portion of her time, will absolutely be valuable in helping us tailor our responses to communicable disease in the future. And I just want to bring it to the board's attention that the spot that she's in, again, only a small-time role, was vacant since the untimely death of Dr. Hartledge. We had 0 applicants for that position, so we appreciate the mayor's office allowing us to be creative and find some ways to bring talent into the department. And moving forward, both public health in Louisville Metro and across this state, really got to be creative in the ways we hire people moving forward. That was the only thing I really want to mention to the board. Thank you very much.
Well, her experience is invaluable and a tremendous add. And I can't say that enough and look forward to meeting her in person. Thank you. Thank you for all you've done. Community Advisory Board members, I'm not going through everything. Are there any issues that need to be acted on by the board? I do want to thank Dr. Irwin and Ms. Shoemaker for the outstanding work that they do to bring together all of the organizations involved in Medicaid and public health. We meet semi-monthly. It's a meeting that I try not to miss, but it's a true best practice in bringing 25 organizations together. And one can see the power of the collaboration and the need for not only exchanging information, but best practices. So a shout out to you both. So anything that needs to be acted on as a result of Community Advisory Board members? And while we're doing that, any key committee items that need to be voted on? Any new business or announcements from the group? Okay, I just want to say thank you for joining this meeting during a celebratory week in Louisville. I hope you take a moment as I would say, for human refreshment, and that is not bourbon or a mint julep, but that is for yourself to do something special. It's been a system-changing year, and it taught us a lot. And I think, Paul, your session today indicated that. Director Myman's group as well in terms of action items. Hearing nothing else from the group, the chair will entertain a motion to adjourn.
So moved.
Second.
Anyone opposed? Do something fun for yourself today. And I will see you online, the June meeting. And send your cards and letters if you have comments or emails or texts. Take good care, everyone.
Thank you for having me. I would like to say, Pastor Wood,
Yeah.
thank you for allowing me to.
Well, thank you for what you do.
Thank you.